Deb, what's going on? First of all, let's talk about what the Hensley Behavioral Health Unit is in our hospital.
We are the behavioral health unit for individuals that are 55 and older.
Okay.
And we treat depression, bipolar, schizophrenia, dementia at all different levels. And we right now are seeing a lot of dementia patients.
Big task for you.
Yes.
It's a huge task.
We tend to be cyclic though. Sometimes, Donna, we'll have people our age and for different reasons.
Those young folks you're bringing in. Yeah.
Yes, buddy. But you know, depression can be a lifelong battle,
Yeah.
or it can be acquired like late life depression, as we all go through the changes and the losses that we occur.
Situational depression.
Lots
sure.
of that, yes.
Yeah.
You lose your spouse, you're not employed. Even if you retire, there's still a loss, because after you say your name, people always want to know, well, what do you do?
What do you do?
Yeah, so
yeah.
it's like part of our identity. So
Disappears.
I see people that are struggling on several levels.
Okay. Now, you said that there's some changes that you've made. What are those changes?
Well, historically, everyone went through the emergency room department, and they were evaluated for physical health issues. And depending on what's going on down in ER, you know, you might be there 30 minutes or you might be there 4 hours, because if a major trauma or something comes in, you're going to be bumped.
Right.
That's just
Right.
just good policy.
That's the whole thing we're always trying to explain to folks, because
I know.
they think it's a, you know, it's like, well, I was here first, and
Yeah.
it's like, yeah, but
Yeah.
everything is triaged, and
It is.
they don't see, our patients don't see when they're in the
Yeah.
waiting room what's coming in the back door
They
from
don't.
a car accident or something. So,
But what I was hearing from all of the nursing homes and the physicians' offices that we work with, you know, it was a big dissatisfier that the patients had sometimes a lengthy wait. So we all put our heads together and we decided we would do direct admits
oh, that's great.
from a doctor's office, a clinic, or a skilled nursing facility.
Okay.
If you're coming from home, say it's a Saturday afternoon and things have happened, then you're still going to need to go to ED. But for the most part, we'll do direct admits with everyone. I go to the doctor's offices. Several of them will call my cell and ask me if it's where I can come. And I will go to their office and screen the patient and then do the direct admit.
Okay, that's how it's being done. Boy, does that put a load on you. That's
Oh,
a big task.
But it's one that we need. It's
Yeah.
one that's been needed. And I'm working with home health now. I go to the homes. I screen patients there. Any of the nurses can call me in. So we're trying to close all the little hiccups and make the continuum smooth.
That's awesome. That's awesome. Of course, speaking of awesome, we've got our wonderful Dr. Foster, psychiatrist, that is with the Hensley Behavioral Health Unit.
Oh, he is outstanding.
Yeah.
He is just
He's what we've
outstanding.
needed for a long time as
That's
well.
very true,
So-
very true. And he is, you know, he's young, he's energetic, he's forward thinking, and, you know, I can put forth ideas, and, you know, he kind of helps me problem solve through them. And Crystal Brightwell, our nurse
Yes.
director, she is phenomenal.
Yes.
And man, our staff has grown, and as we've developed and changed, everyone's just moving right along.
That's great. That's great. It's something, as you mentioned, very much needed in this area. I love the idea of the direct admits. Can you give us an example, maybe from the nursing home aspect, what you might be dealing with?
Well, sometimes from nursing homes, say they all have special areas. They call them either like a neighborhood or the Glen or some sort of a behavioral unit. And the individuals that are there are monitored closer than just a general population would be. And as their behaviors wax and wane, if they're not able to redirect, if they're not able to calm the situation down, they will call us lots of times, because sometimes they'll get violent, and they will hit someone else, or they'll hit a nurse. So they will come to us. We will do the assessment. We usually need to tweak the meds, kind of get them back on a sleep cycle,
Right.
and then go from there.
Which
And
can all be done up in the Hensley
Oh,
Beach.
sure.
Yeah.
That's what we do.
Yeah.
And, occasionally we get someone who doesn't want to be there, doesn't see the need for our service, but everyone else does. And we sometimes put people on 72-hour holds, and then we go to the court, and the individual then goes before a judge, and the judge makes the ruling as to whether or not you're going to go for treatment or not. And so we do that occasionally.
They really aren't capable of making the decision to take
No.
their medications. I think that's always a big one, isn't it?
It
That I
is.
refuse my medications, and you can't do anything about it without
you
a court
really-
order
you
or
really
without.
can't.
Yeah. Yeah.
But once you get someone back on their medication and they begin to stabilize, then, they themselves will see the need. And then they'll go back to their living arrangement and be fine for, maybe forever, or maybe there'll be another glitch.
Right.
With dementia, you'll see changes that will occur. And meds need to be changed, and that's the beauty of having Dr. Foster there.
Absolutely. That's his area of expertise as a psychiatrist. You bet.
And that helps tremendously.
Yeah. And I know that I've talked with Dr. Foster, and when you say dementia, so many people automatically equate it with Alzheimer's disease. There are so many different types of dementias.
Oh,
And
yes.
Dr. Foster, of course, is extremely knowledgeable on what to look for and to be able to diagnose those, the different ones. But yeah, if you've got someone then, say in the nursing home that's they may be something that they could be harm, as you said, another nurse, another resident,
Right.
themselves.
Right.
Yeah.
And we have, and I salute every one of them, but we have a great many families that care for their aging parent in the home.
Wow.
And,
yeah.
The changes are progressive in any of the dementias. And maybe what we did this month won't work next month.
yeah.
So we have a lot of family members that come in and bring their loved ones to us. And, we're able to help them. We're able to help give them a list of tips for how to deal with them in the home. And once a week, we invite family members and nursing home staff to come for rounds with the physician. So we're able to
Great
outline
idea.
medications that we've changed, anything, any structural thing that we've done, like with sleep time or meal time or how we operate that. And we'll answer their questions. And families have a lot of questions.
Yeah.
So, we're able to do that, and now we're doing, we're a little more active now in the dementia support group from Fairland that's held at the Maroc Fridays at, this Friday at 3.
This Friday at 3. Okay.
And I'm going to be the presenter there, and we're going to be doing
that's
tips
great.
for caregivers. And it's going to talk about how to take care of yourself.
Which is
Because-
crucial. Yeah.
We forget, but if we don't take care of ourselves, there's nobody
Then
else.
you're no good to anyone
Anybody,
else. Yeah.
no.
So,
But we have information in our packet about how to approach mealtime, how to approach bathing, dressing, little tips that we've learned along the way that decrease the stress.
yeah. Yeah, I think, would you agree that a lot of it has to do with not only educating the caregiver, but to really have them grasp the thought that this is no longer your mom or your dad. This is, your roles have been reversed.
Yes.
And you're absolutely the one in charge. So you're not the young daughter or son or,
Yes,
yeah.
and that's hard. That is so
Oh,
very
yeah.
hard. Personally, in my husband's family, my mother-in-law's been diagnosed with Alzheimer's about 9 years. And, my father-in-law, God love him, still is the caretaker. But, it'll be like, Earlene, we need to go do so-and-so. And I've already done that. Well, no, she hasn't.
Yeah.
Sometimes whether it's your spouse or it's your mom, you forget that it's not a suggestion.
Yeah.
you kind of have to take them by the hand and lead them.
Yes.
This is what we need to do now.
Yeah.
This is where we're going to go.
Yeah, because you're not
it's-
really
Mm-mm.
dealing with the rational mind or the person that you once knew. And many Alzheimer's patients that I've met over the years are extremely clever and can mask it
Oh,
beyond
yes.
belief.
The wonderful term we use is confabulation. They can take their environment and make sense of it, and you're
Yeah.
just going, whoa.
Whoa, yeah.
It's amazing.
Why
what
do we
they can
have all
do.
these Post-it notes?
I know. I know.
What's with the Post-it notes? Yeah.
But they figure these things out, you know, and it's so hard for families because they love and want to nurture and they want to take care of this person, but the response they get back is different. Words don't always carry the same meaning they carried when they were younger.
Yeah.
Because you lose certain aspects of language. And as that occurs, then the communication and the things that you could share becomes more narrow and less often.
Do they still recommend, I was always taught that the long-term normally stays intact for
Yes.
Alzheimer's patients in particular, and that we were always taught to ask the person how old they are. It's going to give you, and people say, why on earth would you do that? You know, mom's 82, something. No, in mom's mind, she might be 24.
Yeah.
She may,
36,
36.
whatever.
She may be locked into a time back then. And boy, once you get the answer to that question, a whole new world opens up
Yes.
for you as far as
Yes.
communication goes.
Oh, yes.
Yeah.
It's very true. My mother-in-law sometimes, she always knows who I am, but the last 40 years that I've been in the family may not be real clear. So sometimes she talks to me about when we were in high school together, and I just go with it.
Yeah.
Okay.
Yeah.
Because arguing and correcting agitates the individual, and it agitates you.
Sure.
You know,
Sure.
it's just, you set yourself in a spiral then of discomfort that you don't have to be
That you
in.
don't have to be in. Let's go into that a little bit further. We need to take a short break. We'll be right back, so don't go away. Talking with Deb Way, Director of the Hensley Behavioral Health Unit.